Good afternoon, everybody. Welcome to the second session of our Women's Day program. So, yesterday we spoke about our importance of, nutrition, diet, and medical knowledge or awareness in teenage girls. And today it's lifestyle designed gynecological issues. So today with us, I have eminent speakers and experts of their own fields. We have a few doctors joining in later. So let me start off by introducing our dear doctors. Um, Firstly, I have Dr. Nanda Rajneesh, an eminent surgeon endowed with rich and diverse experience and distinguished academic record, has established herself as a specialist in breast surgery. Dr. Nanda practices at Apollo Spectra, Bangalore, and she's known for her minimal invasive gastrointestinal surgery and surgical oncology. Ma'am is also a specialist in bariatric surgery and all kinds of minimally invasive and laparoscopic surgeries for GI and rectal region. She's trained in GI surgical oncology from the prestigious Tata Memorial Institute, Mumbai, and Heidelberg University Hospital. So, welcome on board, ma'am.
Thank you,
Next,
Sharon.
we have Dr. Sunita Samal. Sunita Samal is a laparoscopic surgeon and a gynecologist in Chennai, and Madam has an experience of 24 years in these fields. Ma'am is also known for gynecological endoscopy, gynec laparoscopy, fertility procedures, and complicated pregnancy treatment. Welcome on board, ma'am.
Yeah, thank you.
Then we have Dr. Sultana Banu. Dr. Sultana is a gynecologist and laparoscopic surgeon based out of Chennai. Ma'am is having a rich experience of 19 years in this field. And some of the services provided by the doctor are laparoscopic surgery, fertility treatment, gynecological endoscopy, and obstetric problems. Welcome on board, ma'am. So, we have Dr. Lakshman Salve and we have Dr. Shivani joining us soon. So, I think without much delay, I will start off with the panel discussion. So, as you all know, I mean, women are very vibrant hormonally, and
We cannot hear you. Just go forward.
am I audible? Am I audible?
Yes, you are audible.
Yeah. So, as you all know, that women are naturally hormonally vibrant, and there are different vulnerable groups of women. So, today is lifestyle-based gynecological issues. So, Dr. Sultana, am I audible to you?
Yeah, now you're audible.
Yes.
Yeah,
Welcome, ma'am.
yeah. Hi.
Okay, so the first question here is to Dr. Nanda as to who is responsible for women's health at home, because a woman is so busy looking after her family and the children. So, who is really responsible for women's health at home?
Sharon, as you rightly said, uh, the women always look after everybody around them. So, who is responsible for taking care of them? So, there are two things here. One is
अभी
mentally
आपकी
and
वर्ड मीटिंग
psychologically what she should feel about herself and how she should find a time for herself. So, who is responsible? Question is, she herself is responsible for taking care of herself. I always tell when a lot of my anal fissure patients and all they come, that is because they're not eating food on time. They eat less foods. So diet is a very important part of their life. And they don't think about it. So make sure you eat fresh food. The women should eat fresh food. That's very, very important. One is eating fresh food. The women should look after their diet. And also they should find some time to do exercise. Which is the right exercise you have to find out. It's very, very important. Okay. And sleep well is extremely important. And find time to sleep. Because what happens if they, I always tell one story to all of my patients. If they buy three pomegranates and if they have two children and a husband, all three will be given to them and only one spoon the wife will eat. So she has to have her own portion of food. She has to have her own portion of time for herself, because women are very emotional. Instead of being emotional all the time, start having knowledge about everything around you for the better about others. Knowledge can change you more better than being emotional.
Great, yeah.
This echo is there. What is the reason?
I think, is it clear? I think it's clear.
It's an echo. What is the reason?
Voice is not very clearly audible.
Yeah, see, there is
Yeah, there
echoing.
is.
There is some problem. Can you, Shine, can you sort it out?
I think I'll. Is it better now? Okay, I think it's better now. Okay, maybe it's a technical glitch, but however, Madam made a very nice point that she herself is responsible. I think that's really true. In the meanwhile, we
Am I
have our other.
audible to anyone?
Yes, yes, you are, ma'am.
But I
So I
can't
think.
hear anyone. I'm trying to do all the changes, but somehow I can't hear anyone.
Oh, no, no, you're audible to us. You're audible.
Okay, I think continue. I'll just speak to Sarika. Why is it not working? You can ask the question to the next panelist. I'll just probably see what's the problem.
Okay. So I think we have the other doctor who has joined in. That's Dr. Lakshman Salve. So, sir, am I audible to you? Dr. Lakshman, am I audible to you?
Yes, you are audible. I can hear
Okay.
you. The voice is little cracking, but I can understand.
Now it's better. Just go ahead.
Yes,
Yeah.
yes. So, sir, welcome on board. So, Dr. Lakshman is a professional with more than 15 years of experience in general colorectal and laparoscopic surgery. He is an expert in colorectal surgery and proctology. So, he does laser surgeries for piles, fissure, fistula, and star surgery for chronic constipation. It's nice to have you here, sir. Welcome. And I think we also had Dr. Shivani. So, anyway, so I'll just continue with the next set of questions. So Dr. Nanda made a very nice point that women are responsible for their own health. So my next question is to Dr. Sunita. So ma'am, what about the effect of PCOS? Because whenever we talk about women health, this is a very common thing: PCOS, PCOD. So effect of PCOS on reproductive health, how does lifestyle matter in this?
Yeah. So nowadays you can see like this PCOS is more prevalent among the younger population. That is mostly the lifestyle because most of them regarding the food and the obesity and their lifestyles like less sleep, more of stress, all those things give rise to all this PCOS. And once this PCOS happens, they will have starting from this adolescent time reproductive health until the latter part of the life means around perimenopausal or the menopausal age group. Like in the initially they will have the irregular cycles and they will get lot of this acne, hirsutism, a lot of hair fall, and in the course of time they will end up in the fertility issues also. So I will advise the young population particularly have a proper food. Means most of them they don't eat the proper diet like what you eat like a rice, dal, or the vegetables and all, and most of them eat some this junk foods they don't eat a normal diet like when they go to school or college like most of them are pizza, burger, sandwich, like all kind of things. So I'll advise them to take lot of good food means lot of vegetables and fruits and daily drink lot of water and some workouts and all of the means now also some classes because of this covid and all it is happening some like online classes and also that is the physical workout is very less. So in that cases the sedentary lifestyle, the food habits and like late night sleep, all this like together it give rise to lot of problem in the the teenage girls particularly, which will affect the menstrual health and also in the latter part of the life to the reproductive health, and in the late it can again all the metabolic disorders like diabetes, like hypertension, and also cardiac issues are also more common in those in the latter part of the life, and even the gynecological cancers. So those who are having a PCOS or obesity and infertility, all those they can have in the latter part of life endometrial cancer and all. So for that reason, they have to now in the adolescent or the teenage group, they have to do some lifestyle modifications like a good sleep, have a healthy diet, and good lifestyle. So that can change the latter part, like their fertility, reproductive health, and also in the around perimenopausal health also.
Right, right. Absolutely well taken, ma'am. That's absolutely true. So, since you brought it up about gynecological cancer, my next question is to Dr. Sultana. So, is gynecological cancer, I mean, related to lifestyle? Like, how much is it related to the lifestyle?
So if you see when we talk about gynecological cancers, we mean the ovarian cancer, the endometrial cancer, and the cervical cancer. So of these, when you notice the ovarian and the endometrial cancer are very much related to some of the modifiable risk factors. So there are some risk factors which where you cannot do anything about it. That is completely genetic. You get those the genes from your parents, and if any of your parents are suffering from any of these cancers, so probably you are also at the risk of getting the cancer. But this we cannot change, which means we cannot modify. But there are some other causes like modifiable risk factors, and some of these are all the cardiometabolic causes like obesity, diabetes, hypertension. Now all these are interlinked. So once you become obese, there's always a lot of chances for you to become a diabetic. And once you become diabetic, it becomes a risk factor for you to become a hypertensive. On top of it, if you have a family history, then again it adds on to these risk factors. So all these, risk factors is because of the kind of lifestyle that we lead. This thing, truly speaking, it is so demanding these days because our parents used to work between 9 to 5, but that is not at all possible these days because you need to run the race and you become a part of the community. Like everyone does the same thing, and it looks abnormal when you do not do something, but that is not right. The right thing is to have the right sleep, right diet, and right kind of exercise, the physical activity. So when we do all these things, probably everything sets in. So we more think of the monetary benefit and not just monetary, but also to show off to show how talented you are. But we do not take care of our health. So in that way, lifestyle plays a major role, not just any disease. I mean, you can name any disease and you can say that you can modify it by doing a lifestyle management.
True, that's absolutely true. Thank you for that, ma'am. But my next question is to Dr. Lakshman. So, how do you deal with women? Because hardly when it comes to these colorectal issues or anal issues, people are not very vocal about it. Women, especially, they don't talk about it. So, what are the lifestyle and dietary instructions that you give your female patients to avoid constipation and anal problems like piles and all of these?
Sorry. So piles is a very common problem, and this happens because of constipation. So constipation is the main thing which leads to more of colorectal problems. And to avoid constipation, they should have good lifestyle and good dietary modifications or dietary changes in their lifestyle. So in dietary changes, what I can suggest is main thing is you should, I mean, the everybody should take good amount of water, around 2.5 liter to 3 liter of water, and they should have good high fiber diet, which includes salad and citrus fruits. Specifically, I'll say citrus fruit because it gives benefits of vitamin C also, and it gives benefit of fruits and fibers and all those things, vitamins and all those things. At the same time, they should avoid taking low roughage diet, that is maida products or white flour products, which are mainly bakery products, which are bread, pav, biscuits. All those things should be avoided. And you will realize in the middle class or low socioeconomic group also, they are taking lot of bakery products, and that is giving rise to constipation. At the same time, they are not taking enough adequate water also. So this is very important to avoid constipation. At the same time, I mean, good number of steps. Like you should, the lady or everybody should walk at least for 20-25 minutes in a day, because of a lot of sedentary life which is happening nowadays. People are not walking enough. So good exercise, walk at least, and good dietary modifications and lifestyle modifications will definitely help in avoiding constipation and hence piles and other problems.
Yes, sir. Thank you. Thank you for that, sir. My next question is to Dr. Nanda. How stress can cause gynecological health issues? Because, ma'am, as you know, a lot of them are stressed unknowingly or knowingly.
For this, we have to know what is stress. Firstly, stress is a psychological and chemical reactions. The multiple reactions that happen in the body. So, stress can happen. One is external stress, that is loss of relationship, absence of money, the financial issues. So stress can come due to many external factors, but stress can come due to internal factor also. Some chronic diseases can also induce stress. So what happens really in stress is there is a huge set of chemical reactions happen. These chemical reactions that happen are similar to what happens in the immune system also and in neurobiological system. So there is a huge connection between the neurobiology, immunity, and stress factor, that stress reactions that happen. So these reactions that are induced, they actually huge cause a huge hormonal shift, because hormones require certain raw material. Stress utilizes all the raw materials, the hormones go down, or they get deranged, or they get overstimulated. So because of this, women will develop certain imbalances. And hormonal imbalance is something, either more hormone or less hormones. So once that imbalance happens, it becomes a vicious cycle. Okay, the one organ gets damaged, another organ will get damaged. Polycystic ovarian disease already has been discussed. It's one of the major gynecological issues. Then thyroid, you see, women with a lot of stress, so themselves will have thyroid issues. So similar to that, she will have imbalances, in imbalances leading to immunity getting disturbed immune system can lead to cancers also. So stress, immune imbalance can lead to cancers, because we do know that the there is a cell mediated immune system that is needed for the any cancers, whether it is breast cancer or gynecological cancer or any other cancer in the body, because we need something called an apoptosis. So all these mechanisms get disturbed when there is a lot of stress. So this is the reason you should be aware stress can chemically react so much to cause deficiencies, in turn lead to many gynecological issues.
True, true, ma'am. Thank you for that wonderful explanation. My next question is to Dr. Sunita. So, like ma'am said, what happens with stress? So, we see a lot of fertility issues these days. So, what could be the reason for that, ma'am?
Age. Like previously around 2021, most of the like women they get married and have complete the family before 25. So now the marriageable age you can see, because females are more career oriented and all those things. So marriageable age has also increased. And after that also, once you see they are getting married around 30, and this PCOS problem what I told, the lifestyle, the way they maintain their lifestyle and the age of marriage is delayed. So naturally the fertility is delayed. So now when I see my patients in the infertility OPD, so most of the patients they get married after age 30, and after 30 also they don't want pregnancy. Used to tell, no, my career is not settled, we are not planned pregnancy like that, and we'll do after 2 years, 3 years. And by the time they land up in the plan to pregnancy, and a lot of other issues like this PCOS, endometriosis that has become the very like the major cause of infertility nowadays, and also along with that the male infertility. Like previously we never used to get that much of male factor, but now also it has come because of again this lifestyle same. like most of the time like sticking to this gadgets like mobile, laptop, and late sleep, diabetes, lack of exercise, all those things. And so we should like advise the like nowadays girls keep like the ideal age for pregnancy starting from 20 to 23 to 27. By that time, if they get married and become like complete the family, that will be nice. But lifestyle modification means one healthy lifestyle, daily exercise, that is more important, and the food is most the important factor. And nowadays, like recently I met a couple, so both of them are working, they have a business, they never cook food at their home. They told all the three like times food they get from outside. And the girl is already 30, she's hypertensive, she's diabetic, and now and also she's obese. And she was come for the infertility issues. So this is very like the first and foremost is they have to change the lifestyle, and after that only this I think maybe previously there was not much fertility issues among the like women. So nowadays main is the age of the marriage, and second thing is lot of stress, like one financial factor is also another one. And so they don't want to like start the family early, they want to settle in the life first, then they want to start the family. So I think that all those things has to be like addressed, like the diet, exercise, stress, and the family factors. And now and most of the families are now nuclear family, they don't want to stay in a joint family, so that is also another issue. So they want to delay the fertility, and by the time they like plan for pregnancy, they will have all other non-communicable diseases like diabetes, hypertension, hypothyroidism, and all these factors will be there.
True, ma'am. Thank you for bringing in those practical aspects. So we have Dr. Shivani Sabharwal from Karol Bagh, Delhi, joining us here. Welcome on board. So, ma'am is a gynecologist and a laparoscopic surgeon with 13 years of experience. She specializes in pre and post delivery care, nutrition for pregnant women, maternal fetal medicine, IUD, and many other procedures. It's very nice to have you. So, I think my next question is to you, Dr. Shivani. um, so what are some of the gynecological issues that are associated with poor nutrition? You're not audible, madam.
Can you hear me now?
Yes, yes.
Okay. Thank you so much. I think it's an excellent platform, first of all, to have all the amazing gynecologists and surgeons at one platform and giving such basic information. And I think something which has been lacking. So thank you for doing this. Now, coming to nutrition, unfortunately, nutrition, the spectra, both overweight and underweight, has its own issues. Underweight, unfortunately, is less spoken about, but India is a country which is lacking nutrition probably at every level, not only macronutrition, even a micronutrition, coming from every level and every strata of family, whether it's a poor family or even, with rich people, because the lifestyle, the diet modification is so much nowadays that the ladies, they don't realize that they are lacking and a lot of micronutrition. Macronutrition you will see very easily, they're very skinny people and all, but micro might be missed. So both have to be balanced very well. And as I said, this is another spectrum. So let's talk about the common nutritional things which are lacking in India, especially anemia. Still, India is a country where anemia is a very, very big concern, especially for young women who are going to get pregnant. So we want every person to have a good human. The growing girls, all the school going girls have low hemoglobin. That all affects your growth in pregnancy. It can affect the intrauterine growth of the pregnancy. Even severe anemia can even lead to IUD, intrauterine death. So, hemoglobin has to be regularly monitored in these patients. People should be taught the, basic diet which is easily available. We should not go for very high, expensive diets, which will provide us iron. Our basic vegetarian diet can give us very good iron. So, education has to be there to all the people that, eat your normal seasonal fruits and vegetables, the green leafy vegetables, your jaggery, which is so good and rich in Indian diet. We should start having those things, and that will improve your hemoglobin. Avla. Think of basic things. You don't have to eat very high end food, like salmon or broccoli or, go for a basic diet. Simple iodine, that's a very common micronutrient nutrition which can be which people especially in hilly areas have deficient. But nowadays we see less of this deficiency because most of the salt and most of the food is iodized. Even bread nowadays have been iodized. So these deficiencies definitely less, but vitamins deficiency, especially B6, B12, they are very high. Vitamin D, mostly I think every Indian, I think we as a doctors are also lacking vitamin D. So these micronutrition has to be very well managed. Other than our macronutrition, that's our protein, carbohydrates, and fat. So everything has to be given equal importance, and that importance has to be taught by a gynecologist or any person who you're meeting as a person. Give them education about the importance of nutrition, not only at reproductive age, from the younger age group. So pediatrician's role is very important in this. So make all your doctors as your friend, ask them these questions. They are very see, this can be managed very well at home. You don't have to reach to a stage where you need your medicines. You can manage very well with the nutrition at the diet level only.
So thank you for that, ma'am. I think diet and nutrition, they really play a very important role even before you go to medicines. So my next question is to Dr. Lakshman. So what are the precautions that pregnant ladies should take to avoid perianal problems, sir?
Sorry, please repeat.
So I
Hello.
asked you, what are the, yes, sir. Am I audible?
Yes, yes.
Yes. So I said, what are the precautions that a pregnant woman should take in order to avoid the perianal problems?
Okay, so perianal problems are very common in pregnancy. All of us know that this happens because of the gravid uterus pressing on the IVC and giving rise to congestion in the blood vessels of the humeral plexus. So, in this situation, basic instruction for all these ladies is to sleep on the left lateral position, and these piles. If even if they bleed, they are physiological, and most of the time with the conservative management they do respond to most of the time to the conservative management. But to avoid all these problems, one very important advice I can pass on here is all the ladies who are going to get married or who are going to get pregnant, and if they are having any problem of piles, fissures, fistula before having pregnancy, they should get it settled first, and then they should plan for pregnancy. Because it becomes very difficult in the pregnancy to manage all these problems. I come across so many ladies coming with bleeding PR, something coming out of rectum, or painful defecation, and their life is miserable. So one important message, and when all the ladies who are about to get married or about to get pregnant, I ask them to get fixed this problem, and then they should go for pregnancy. During pregnancy, as I told you, this problem of piles, which is the most common condition, can be managed easily with the conservative management, that is sleeping on the left lateral position, taking rest, and taking good amount of water. This will help in management. But in sometimes patient ladies who have fissure in ano, and they are if it is very severely painful, then we can give some anal muscle relaxant cream, like Anoblis, which contains nitroglycerin, and then we can manage them conservatively also. If something happens very serious, something like very severely bleeding, piles are prolapsing out, not going inside, or the lady is having severe pain because of infected fissure or abscess or something, then we can manage these patients under local anesthesia also, and get them cured with the temporary solution for those problems. So my take home message will be, if you have some my any of perianal conditions, then settle it before going for pregnancy.
Thank you, sir. That was very informative. My next question is to Dr. Sultana. So, how is sleep connected to women-related problems, ma'am?
So actually, sleep is a very important aspect of lifestyle because you need to sleep that adequate amount of hours so that your body gets regenerated. It is during the sleep that your brain gets, it tries to store new signals and it tries to regenerate, and the neural cells try to, interpret things and all. and the body also gets rid of the toxins during the sleep. So when you have adequate sleep, the stress factor actually comes down a lot because you have taken enough sleep and enough sleep, and so that you feel more rejuvenated when you get up. So the hormonal levels, that is the metabolism of hormones, takes place mainly during sleep. So there are certain hormones which are secreted during the sleep, which helps to restore your body. It tries to repair, like wherever there is an abnormality, it tries to repair, and so the cells gets regenerated. And when this sleep is disturbed, for example, it's quite common these days because the kind of work that we do, like most of them work during the night hours. So they do a lot of, if you can see the BPOs where they try to work according to the other continent times. Like for example, they work according to the American or the Australian times, just like that. And so they do not sleep properly. And moreover, they do not have the enough sleep also. They try to home work and things like that. Now, all this leads to stress. Stress is an important factor which can lead to many gynecological issues. Say, for example, if you name any gynecological issue for that age group, say for adolescents, you can think of a PCOS. Not just adolescent, and any age women who is menstruating can have PCOS. Stress plays a major role, and also fertility also, because as Madam rightly said that we see women who do not concentrate on pregnancy because they want to be settling financially and career wise, so they concentrate more on that and they do not concentrate on fertility. In that way it affects fertility. The other factor is that because when your sleep is disturbed, your brain doesn't work properly. So what you tend to eat more and you gain weight. It becomes a vicious cycle, and one comes after the other. If your sleep is not good, then what you do, you tend to eat more at the night hours where you're supposed to sleep. And then when you eat more, then again you end up becoming obese. Then when you become obese, then you have the other the cardiometabolic risk factors like diabetes and hypertension one by one coming into, and this leads to other gynecological issues. For example, endometriosis, and when as we age, like cancers also can be a cause for this thing. And moreover, the other gynecological issues like fertility issues, endometriosis. Now, all these are like the major. Stress has a major role, and when we try to settle down these issues, probably it plays a major role, and you can see, definitely you can see a difference. But the thing is, when we say this to the patients, they find it difficult and accept the fact that does this actually have any role? But truly speaking, it plays a major role.
Thank you, ma'am. So my next question is to Dr. Sunita. So menstrual hygiene is a very important thing among adolescents, ma'am. So can you please share some thoughts on these?
Yeah. So nowadays, if like everybody might have noticed this, like puberty nowadays, it is coming at very earlier age, around 9 to 10 years, and by that time, the girl is still a child. They don't understand anything. So I think we have to, like in the school education, we have to include this menstrual, which is a normal physiological process, and they need not have to be embarrassed or ashamed like all during the school time or college time if they got the periods and all those things. And we should advise them to use the like cotton sanitary pads, and it has to be changed frequently. And in the school and college there should be a provision to have a proper restroom, and also there should be availability of the clean napkins so that they can like use it in emergency and all. And it is not only sanitary napkins, even for the young adolescents this menstrual cups or tampons, that is also they can use whatever they are comfortable. Nowadays, I don't think anybody is using this normal cloths for the during menstruation. And it is not only the this part. Again, you have to take care of the health, because these adolescents, if sometimes their bleeding is like irregular or a heavy bleeding, they will end up in anemia. So you have to support them with the proper nutritional support along with the regular iron tablet to the adolescent girls. And you have to counsel them regarding the food also. And sometimes this having this pain during the period, that primary dysmenorrhea, what we call, like it is a common physiological things. But sometimes when the pain is more severe and they need to take the medication, or the bleeding is very irregular or heavy, they definitely should meet a gynecologist and to find it out what could be the cause. Even for a like endometriosis or adenomyosis, it is nowadays it is more common in a young adolescent population. Maybe it may be hereditary or immunological changes, or if you say the environmental changes. So when the like particular girl is having like it is not away from the normal bleeding or she has very severe pain during the menstruation, which is not like she has to take some medication. In that case, definitely they should seek consultation with the gynecologist to know the cause. And during that time, have a like to avoid spicy and the more of high carbohydrate food should be avoided. They should take lot of fluid and do some exercise and take lot of like high protein and this kind of diet so that they will feel comfortable during the period. And even sometimes the pain is there, we can prescribe them the antispasmodics. So basically, we have to educate them. This is a normal physiological process, and they should maintain the hygiene means regarding the use of and even the using of the the panties. They should use the cotton panties during that time, and pad has to be frequently changed so that there should not be any irritation. And sometimes some people get rashes also, so you should advise them to use the cotton pads and also cotton undergarments. And even the disposal of the pads also. There should be some provision in the school and colleges so that it should be disposed in the proper manner. And restrooms they have to clean it properly. So that also we have to advise them. So in the school itself, we should educate. I maybe some like regular classes or some gynecologist can go and talk to them regarding this like process.
Yes, ma'am. Thank you. Thank you so much. That was very informative. And my next question is to Dr. Nanda. How hormones play a very important role in well-being of a woman, ma'am?
Yeah, this is a good question, Sharanya. Uh, See, there are many hormones in women than in men. There are type of hormones that play in different organs, and emotionally also how they play on a woman is very different. So hormonal imbalances are very, very common. If hormones are good, they look very well flushed. Women look beautiful and very well flushed, and they can even become slimmer, and because the metabolism is better if the hormones are good. So we see, when there is a shift of the hormones in menopause, just when they're reaching menopause, there are a lot of mental disturbances, physical disturbances, overweight. These are happening. So why do this hormonal imbalances happen? Basically, hormonal imbalances happen when there is a nutritional deficiency, when there are some infections in the body, and the sleep disturbances and overall lifestyle disturbances, nutrition disturbance, the kind of nutrition you take, they all play a huge role in balancing your hormones. So once there is a hormonal imbalance, we must have seen many women are suffering from something called fibromyalgia, arthritis. So they not only have the disease related problem, they also have hormonal imbalances. So they may have associated hypothyroidism that can lead to the gut related issues, constipation and fissures. It can lead to the obesity, gallstone formation, hormonal imbalances. One of the reasons for gallstone itself in women. So, and many gynecologists have spoken what hormonal imbalances can lead to. In young women, it can lead to infertility, and in older women, it can lead to the mental disturbances and hot flushes, and physical disturbances also. And so, overall, hormone plays a very, very big role in overall well-being of the women.
True, ma'am, that's correct. I would like to thank Dr. Sunita for joining us. Ma'am has an emergency, so she has to leave. Thank you, ma'am, for being here, and thanks for your time and your valuable inputs.
Yeah, yeah. Thank you so much for the opportunity, and also I thank all the panelists. Yeah, thank you so much.
Yeah. Moving on, my next question is to Dr. Shivani. So, ma'am, what is your take on smoking or alcohol consumption with respect to the lifestyle based gynecological issues?
Hello.
Yes, Dr. Shivani, was I audible?
Yeah, you're audible. The voice is breaking in between. There's a lot of disturbance coming from somewhere.
Okay.
I don't know from where.
Okay, I'll just repeat the question. So, what's
Yeah,
your
I've
take
understood
on?
the.
You got it. Okay.
Hello. Yeah. So alcohol, unfortunately, young generation, it's the new thing. Probably I think our generation used to drink, still had that thing. Then we had to wait till 18 or maybe more to have drinks. But nowadays, much younger girls and boys are drinking alcohol. And obviously, the longer the duration of alcohol, the more the side effects. And unfortunately, women and men are both different. Their body is different. The biochemistry is different. The way alcohol absorption is definitely much more, it takes much more time to metabolize in a woman's body vis-a-vis a men's body. So the accumulation of alcohol is much longer in a woman rather than a man. I'm not saying it's good for men, but yes, it's bad for both. But yes, the effects are much more seen in a much lesser dose of alcohol compared to a man who has had the same. If a girl having a one drink vis-a-vis a girl having a two drink, you will see a girl will have effect in a much lesser dose. So the effect of this also is also correlated to how much you drink and how long you've been drinking, and the effect can be seen in all levels, start from young girls, which they are more prone for depression. It has all kind of psychological impact and physical impact. So depression, suicidal tendencies are much more in these girls. They're you can see the school, they might not study well, the attention span is much lesser in these patients. And if a pregnant lady is having alcohol, they have another impact on the baby. The fetal alcohol syndromes are seen in these babies, IUGR babies, and these babies, when they grow and they don't do much, the cognitive development is less. Then coming to the other effect to other organs, prolonged drinking definitely can affect the liver, it can cause cirrhosis, alcohol induced hepatitis, pancreatitis, cardiac problems. So every alcohol has very bad effect, unfortunately, and there's no such fixed dose that this much alcohol allowance is there, in a woman, that if you have this much alcohol, if you go by WHO guidelines which we follow, there's no as such allowance that this much alcohol is good for you. So in general, I would say best is avoid alcohol. It has no benefit. But if somebody is having alcohol, I would say probably a one glass of wine a week is still okay rather than having a daily drink. So you should know when to stop and how much you should drink. Uh, You can never say a woman to totally stop someone who's having socially. It's fine. One or two glass of wine is fine in once a week. But overall, the recommendation would say avoid alcohol. It has more than enough literature here which shows the how
She's getting called, no?
so just like all these nutritional abnormalities, alcohol is also one modifiable side modifiable disease which we can avoid any side effects. This is something which is under our control. So if we stop it, we'll only have a good effect of that.
True, true. Thank you, ma'am. That is very well taken. So, my next question is to Dr. Lakshman. So, what are the colorectal problems in perimenopausal females, sir, and how do you manage them?
So, am I audible?
Yes, sir. Yes.
Ah. So, in perimenopausal age, say around 45 years of age, 45 to 50 years of age, I do see lot of people, lot of females who are complaining of constipation. Now, what happens when they go to toilet? They are not able to evacuate themselves out very comfortably. Most of the time, they require to do some maneuvering to take out the stools, and sometimes they need to put their finger inside the rectum or to evacuate themselves completely. So this happens because of multiple reasons. One of them is if they had multiple pregnancy, or even if they did not have multiple pregnancy, their pelvis is weak. And if they have some episiotomy or some forceps delivery, I don't know something, but that pelvis become weak. At the same time, these females can have problems like low backache and all those things. So what is needed here is, um, uh, they are having weak pelvis, weak perineum. So we need to educate females to have good exercises, perineal exercises, to make their perineum little stronger. And this is if the perineum is not stronger, and if they have perineal descent, we call it as perineal descent syndrome. And if their perineal descent syndrome is there, then they can have multiple problems like cystocele, rectocele, uterine prolapse. All these things can happen. So what I recommend here for all these females, that they should have good perineal exercises to avoid all these problems. At the same time, they should have good lower back exercises also. So what will happen with the lower back exercises? They are strengthening their lower back, which will take care of their lower backache problem. At the same time, perineal exercises will take care of their perineal descent problem, and then they will avoid. Then they will be. They may not have that much severe problem of evacuation while at the time of defecation. So here, one important thing to be noticed is males have two openings in the perineum as against females have three openings in the perineum. So by default, the female perineum is little on a weaker side, so they need more exercises than males to keep their perineum little stronger. If something happens like this, that perineum is getting descended, so there are three compartments: anterior compartment where bladder can descend, middle compartment where uterus can descend, and posterior compartment where a rectum can descend. Now, some ladies may come with only one of the compartment descent syndrome. It may be uterine prolapse, it may be cystocele, it may be rectocele. So, as far as proctology is concerned, if the patient or lady, I mean, there are so many ladies who have this problem, but they suffer in silence. So, here we can pass a message that they should not suffer in silence. They can visit a good proctologist where she can be diagnosed of all these problems and they can be treated. Now, most of the time, even if they go to general surgeon or some proctologist, they may get mistreated for piles or fissure, and the problem of rectocele may not get treated. That is very commonly found condition, where these ladies go to the surgeon. They say that they are not able to evacuate out completely. The ladies land up with the surgery for fissure or piles, but their rectocele is not getting corrected. So here we call this as an obstructive defecation syndrome, where the patient needs to put their finger inside or do some manipulation to take out the stools. And if this is the condition, we initially advise them to take good high fiber diet, good bulk forming laxative, and at the same time perineal exercises. Or if the condition is little on a serious side, then we advise biofeedback mechanism. If the patient is not improving, then we advise them to go for MRI defecography, which tells us about the different compartment situation. What is the situation in different compartments? If the patient is having rectocele, a significant rectocele, that is, we call it as more than 2 centimeter rectocele, then she needs some treatment. At the same time, we also see if the lady is having rectorectal intersusception or rectoanal intersusception. If these two conditions are there, where we can say rectocele more than 2 centimeter and intersusception, then they need treatment, and we treat them with the surgery called as star surgery, which is stapled transanal rectal resection. It is a full thickness rectal resection which happens through transanally only, and we can assure them that they, after surgery, they don't need to go for finger evacuation or manipulation. And their time, if they are spending about 15-20 minutes, or sometimes these ladies spend about half an hour, 45 minutes also in the toilet. So we give them a good recovery, good comfort, so that they are not spending now about 30 minutes, but they can just pass it off within 5-10 minutes or 15 minutes, and they come out of the toilet very early. So this comfort is very significant for these ladies. And these patients in the perimenopausal age are, I am telling you, they are very much underdiagnosed or wrongly diagnosed. So good education has to be passed on in all those ladies in our gynecological fraternity and surgeon also, that these patients can be treated with well managed, well, if we manage them well with all investigations. So these are the conditions which are very much commonly coming up in the perimenopausal age group.
Yes, that's correct. And I would like to ask Dr. Nanda if she can also add on to this. What are your views, ma'am? Because you also see such patients on a very frequent basis.
Yeah, as he rightly said, pelvic issues and anal issues are very common. To add to that, they can have urinary incontinence, sometimes urge incontinence, we call it. That's very common. Even stress incontinence of the anal canal also can happen. It need not be with just with because they have a multiple pregnancies. Even with one baby, I have seen women having stress incontinence. So that is one thing that I can add. But otherwise, he has wonderfully explained everything, Dr. Lakshman.
So
Yes.
for all this, what is important is ladies should have routine regular exercises in the perineal area and in the lower back. That is very important to have good health of the perineum.
Correct, correct, sir. So my next question is to Dr. Sultana. So, ma'am, what do you think are the important lifestyle interventions that one should make in order to, get benefit or prevent these kind of issues?
So, as far as lifestyle interventions are concerned, I would actually divide it as what to be done and what not to be done. So, what to be done as far as diet is concerned, take normal food which you used to take, not something which is common in our place. Say, for example, as one of the panelists very well said, that try to take seasonal food which is available in our own place, not to go for something which is not available in our country, like going in for a strawberry or kiwi, which is not easily available in the country. You can just take whatever greens and vegetables which are easily available in our country, and take normal cereals which is available. As far as the diet, I mean exercise is concerned, try to be physically active. Even spending few minutes of physical activity per day will do a lot of changes. And for things about for not to do is like, there are five things that I say to a patient, to my patients, like who are come to me and ask about these lifestyle modification of what not to eat. I would say, like, avoid outside food, avoid processed food, avoid sweets, like anything which you put in your mouth and you feel that it's very sweet. So avoid those kind of foods, and then avoid ready to make food, avoid salty food. So this is what I say. Like, if you put in any food, it will come into any of these category. So as far as food is concerned, I would say that it's not possible to completely avoid outside food, because say for example, both husband and wife are working and they do not find time to cook. But what I say, like, if you are been eating, 3 meals outside per day, at least cut it down to at least 1 meal per day. Like, try to cook something at least for 2 times a day or something like that. If you take at least once a week as outside food, cut it down to once in a month. Things like that. Take stepwise, measures, rather than doing it drastically, because it is humanly not possible. Because the kind of lifestyle we all lead is, it needs, to do all these things. And then, as far as exercise is concerned, I would say yoga is actually a very good form of exercise, which is very well known in our country, because it is very well also appreciated and taken by everyone. So that is a very good form of exercise that I would advise, like, all my patients, being an adolescent who's coming with periods issues, or any reproductive age group who are finding it difficult to get pregnant, or even pregnant women who are having complications of pregnancy, like pregnancy, I mean, gestational diabetes, things like that, and a perimenopausal age group having abnormal uterine bleeding, having heavy bleeding, or things like that. Again, this plays a major role, because you feel, I mean, you can see the difference when you do it, continuously and consistently, rather than, I would say. And in addition to that, sleep. So sleep plays a major role. Try to get proper sleep. I even I mean being awake for 1 or 2 days a week or something. So it plays a major role, because it is going to make you slow down. Your biological clock is, it's disturbed, and it plays a major role. So at least try to concentrate, and try that you I mean, give some time for your own sleep. And also, I mean, also sleeping in the night, that is more important. And during the daytime, I would say, like, 1 or 2 hours a daytime, it's called as power nap, and that also plays a major role, and it can help you, to bring down your stress. So I think these are the few lifestyle modifications which you can easily do. It's not like you don't have to, like, pay extra or something like that. Of course, we see women going to gym, trying to work out. It is it is okay to do that, but make sure that you do the right kind of exercises when you go to the gym. Get hold of someone who knows like what is your issues. Like for example, if you're going to have a knee problem, like you have pain in your knees, and you try to use a treadmill like prolonged hours, like 1 or 2 hours, then that's going to damage your legs more. So you need to have proper information from the expert who knows like what kind of exercises that you should be doing at what point of time, and what is the kind of the diet modifications that has to be done, and you follow that, then it's going to give you better results than doing it on your own.
True, man. That was very elaborative and it was really nice and very practical also. I think my last question is to Dr. Shivani. So, ma'am, in your practice, what is your take on the long term effects of untreated gynecological issues?
I think I think all problems have to be tackled timely to have avoid any prolonged illness and prolonged side effects. And I think the commonest problem, which I will say, which we see in our OPD is PCOD. You know, it has both spectra. A, it's overdiagnosed also, and sometimes it is just being labeled as it's a very common disorder. It should not be treated. PCOD is one disorder, and we can even say a syndrome if the patient keeps having long symptoms. That it gives long term. There are these patients if we don't treat them. See, this is the excess unopposed estrogen effect these patients have. These patients are mostly obese. These patients have can have metabolic syndrome in long term. These patients are the one who are in long term. They have chance of having diabetes, hypertension, cardiac disorders, and malignancies. So if you treat them, and including infertility, they have probably every effect. So if you treat, and these girls should be caught young at school age. I'm not saying, unfortunately, the problem is even younger girls, 12, 13 periods are also labeled as PCOD, which is also wrong. But yes, if a 16, 17-year-old girl is having a lot of irregular problems and have all the symptoms of PCOD, should be treated. And ideally, they should be counseled also timely. That's very, very important. And if we do timely management of these patients do very well. Second problem, I think, which is also another which is common problem, is endometriosis, which we see a lot nowadays. And unfortunately, it's a disease which is a progressive disorder, and which with time it's going to increase only. And the management, there's a it this can be a topic which can be debatable with most of the gynecologists. Is the management differs, and the management is it's a lifetime management, till the time they attain probably 45, 46 years of age, when you can think of a permanent method for them. But till then, there are different type of approaches probably every different gynecologist will take. And all are more or less good, because what they're handling, what they are seeing in their practice, and that's how they're managing, which is fair enough, as long as the patient is having release of symptoms. But these diseases should be timely managed, because prolonged effect of these diseases, especially in a young girl, because they're young disease of young reproductive age group. They have a whole family to look out at. They have pregnancy, they have their whole motherhood, they have their whole old age age which they have to look at. So if they target it now, then another problem is obesity. Obesity is another thing which should be, it's a lifestyle disease, and if you target it at a younger age, obviously they'll have less side effects of obesity when they reach at probably 40, 45 years of age. So probably I think every disease, whichever disease we talk about, there's no such a thing that any one particular disease has to be targeted. And if we don't manage this, we'll have a problem. If we target this will not have a problem. Every disease should be targeted. At least patients should be on regular follow-up. That's what is the most important thing. The patient should come for regular follow-up. Not all fibroids need treatment. Not all cysts need treatment. But yes, if you detect it timely, obviously you will avoid. I had one patient, I still remember, she was a young 23-year-old girl, which had ovarian cyst, which is just been told by every person, just cyst hai, kuch nahi karna. And unfortunately, she turned out to be a borderline cyst. She was not coming for 2 to 3 years because everyone said it's a normal cyst, or not all cysts need treatment, which is also not a wrong statement. Not everything has to be managed. But timely, if the patient comes for regular follow-up, we can detect it early and we can treat it early. So don't linger on with your problem. Don't read too much Google. Over information is also wrong. Under information is also wrong. So they want to divert you in a very. So I would suggest all diseases should be managed to avoid the long-term problems for them. I
Yes,
think if
ma'am. I
anyone
think
wants
you.
to add to it, can add to it, please.
I mean, I think no, I think you've really summarized it very well. You've covered most of the things. Thank you for that. So I think here I would like to conclude by saying I think the take home message is if exercise is the king, then I think nutrition is the queen. So I think that's very important. And like you said, I think timely intervention and customization of diet, like or diet or anything, you cannot have that one size fits all approach. And talking and your healthcare provider and having awareness is very important. So I think these are the take home messages of today's session. And thank you for your time, and thank you all the viewers, and thank you all the panelists for your wonderful inputs and sharing your practical experiences. So tomorrow again we're having this session and we're talking about the significance of breast health, so please do tune in. And thank you and everybody for joining us. Thank you very much.
Thank you all.
Thank
Thank
you
you.
and happy Women's Day.
Thank you. Wish you all the same.
Thank you very much, madam.
Thank you, sir. Thank you.